Hey everybody, it's Dr. Tyler at Sioux Center Chiropractic, and today I'm here with Lainey. She's a familiar face at our office, and Lainey, why don't you tell us kind of what's going on and why we're working on you today?
Well, we got about 10 inches of rain this past weekend, so I was ripping up flooring and have some pain in my lower back.
Okay, and is it all the time or just part of the time? When do you notice it the most?
Mostly in the morning, and then if I'm, out doing stuff, then it gets kind of pressure, but...
Pressure?
Yeah.
Anything down your leg at all?
Nope.
Okay, cool. Well, we're gonna go ahead and assess her. We'll watch her range of motion, then we're gonna palpate her spine starting in the pelvis. We'll work our way up. Are you having any tight spots like in the mid-back, neck, or anything like that?
A little bit in my neck too, but that's just from every day.
Okay, cool. Well, we'll check it out. Let's go ahead and stand right here. And I'm gonna have you face me first. And I want you to just, with your head and neck, look up as high as you can. And look down as low as you can. Is that harder going down?
Yeah.
Where do you feel it?
Like right above my top of my spine.
Right in the top, kind of where the upper back and neck meet?
Yep.
Now, how about if you rotate your neck right and left? Any pain there?
No.
No? I'm gonna have you go ahead and turn that way. And then with your feet together, we'll check a little range of motion in the shoulders. Reach above your head with this hand and touch the top of your left shoulder blade for me. So all the way behind your head. Yep. And the other one. And good. And then let's reach underneath and behind, touch the bottom of the opposite shoulder. Perfect. That one. Okay. Now turn your head to the right, and I want you to twist your whole body right like you're looking back at me. That feel pretty good? Mm-hmm. And now left. A little harder there?
Yeah, a little bit.
Okay. Now let's go ahead and face this wall. Keep your feet together, and I want you to look down at your toes. Try to touch your toes. All the way down. Any discomfort in the back? Reach above your head, look up at your hands, and arch backwards. Any pain there?
Yeah, a little bit of right here.
Cross.
Just right above my hips.
Right above the hips, equal both sides?
Yeah.
Okay. All right, now we're gonna do one more. I want you to hold your arms out in front and squat as low as you can.
With my feet together?
Feet together, heels stay on the ground.
Oh gosh.
Try that again. Everybody says that. One more. Any discomfort with that?
Same, right above my hips.
Right above the hips?
Yeah.
Okay. All right, let's sit on the end of the table facing that way, and we'll do our motion palpation scan. Lainey has also been a college rugby player, and so she'll come in and get tuned up time to time during rugby season. Her body, she puts quite an amount of wear and tear on her body during that time of year. Are you doing rugby again or no?
I will in the spring.
In the spring. You guys do any training in the fall or not really?
We go to the gym and do some ball handling.
Nice. Lainey is entering her senior year of undergrad, and she will actually be going to both me and Dr. Tiffany's alma mater, Cleveland Chiropractic, or I should say Cleveland University. It used to be Cleveland Chiropractic College. Cleveland University in Kansas City, where she's going to go and pursue her degree and get her doctor of chiropractic, which is awesome. We're really excited for her. Something rubbed off. Any of that uncomfortable when I go back? Come up forward. No. So what I'm feeling on her is she's got a little limited mobility, especially in the right SI joint. And then as I get into her lumbar spine at about L5, that isn't rotating like it needs to, and it's not extending like it needs to. And then I'm gonna check up into the mid and upper thoracic, so I want you to go hands behind your head, elbows together, and then we're just gonna lean forward, and I'm gonna just challenge the joint here. That's really restricted. Uncomfortable right here?
Yeah.
Yeah. So as she works her way up from the lumbar spine into this thoracic region, this is a common area that we'll find lack of mobility, just because in today's world we tend to be more rounded and we're looking down at computers or phones, or in her case over the weekend she's probably bent over quite a bit while she was cleaning out the basement after the flood, and that can lead to more restriction in that region. That sore.
Mm-hmm.
Up there.
A little bit.
A little bit. but she's also got mid-cervical restriction with extension and rotation. Okay, so today we're just going to go through and do an adjustment on all these regions, and then we'll retest her range of motion at the end and see how she's feeling. But typical case like this, we'll follow up a few times in a short duration and make sure that joint mobility is restored and move on to some exercises and things to stabilize the area. So I'm gonna have you start. We'll just go on your side with your right shoulder down facing me. And then we're gonna bend the top knee and tuck that foot behind the bottom knee, right like that. And then we're gonna slide this hip forward, there you go. And I'm just gonna have you hold there. I'll kind of roll your lower body into me, okay? Just take a deep breath in, and then we're gonna let it all the way out. One more. In and out. Good, other way. And we'll bring the top knee up through here. There you go, you know the routine. And then deep breath in and let it go. It's already going. Let's go on your stomach, and then I'm gonna use the drop table, and we're gonna do drops on the pelvis and SI joints. Good. That okay?
Yep.
All right, Lainey. Let's go ahead and sit on the end of the table. We're gonna get you on your back and take care of that mid and upper back. There you go. All right, sit right here, and then swing your feet around. There you go. And I'm gonna have you laying all the way back.
Okay.
Cross arms. That. And when I tell you, take a deep breath in,
Okay.
let it out. Deep breath. And all the way out. And again. Out. One more. And out. Good. Yep. Got it?
Yeah.
On your back. Check that neck. There we go. Ready? Sit down, relax. Your toes. Good. Here. That, relax. Wiggle your toes. Good. Okay. Come back up. And then I'm gonna have you sit down on the end.
Okay.
I'm gonna sit behind you, and I want you to cross your arms to the opposite shoulders. I'm gonna do a little bit of active release on the erector muscles here. So I'm gonna just rotate you back, and then we'll round you forward and away, and you're gonna feel a little tension build under my thumbs. Okay? Go back into the right, down into the left. Feel a good stretch there. You guys have everything all cleaned up in the basement?
Getting there.
We got a lot of homes in town. I've seen a lot of patients this week coming in with, you name it, low back, upper back, neck, shoulders, hips, knees. A lot of people ripping out carpet all weekend, scooping heavy buckets of water. We had a record amount of rainfall in just a few hours in our town, 10 inches of rain, and we had a lot of flooding in basements. So people have been using their bodies and taxing their bodies more than they might be used to, getting everything into the shape it needed to be to keep their homes safe. So we're good without rain for quite a while now. All right, now we're gonna go into the QL muscle. So we're just gonna go straight to the side, contact. The QL muscle is called the quadratus lumborum, and sits right on top of the hip and goes into the bottom rib. And it's a deep muscle that can really affect a lot of low back pain patients. So it's tougher to get to, but when we can get that to release, it does a good job of symptom alleviation, getting their function back. Okay, that one's pretty tight.
Yeah. Feels good though.
A good hurt?
Mm-hmm.
All right. Okay, I want you to stand up and we're just gonna check a couple of these patterns again. So let's go feet together. Do your toe touch for me. All the way down, all the way up. Reach above your head, look up, arch back as far as you can. How do both of those feel?
Good.
Face that way, feet together, and then let's turn to your left and right each way. Good. And then while you're there, look up at the ceiling as high as you can, down at the floor as far as you can. How does that motion feel?
Good.
Better? Cool. Well, there you have it. Lainey has just gotten her adjustment, and I would probably follow up with her again here in the next couple days, but doing okay?
Yeah.
All right. Thank you. Thanks.